Hello everyone. Today we are going to discuss about the etiological classification of anemia. Etiological classification of anemia. So etiological classification of anemia is broadly divided into three categories: anemia due to blood loss, or anemia due to increased RBC destruction, or anemia due to impaired RBC production. So these three are the major categories. So first we discuss about the anemia due to blood loss. So blood loss can be acute blood loss, can seen in trauma or any kind of accident, whereas chronic blood loss seen in lesion of gastrointestinal tract, gynecological disorders, etc. Now the second category is increase RBC destruction or hemolytic anemia. So there are multiple reasons for increased RBC destruction. We will cover them one by one. So inherited genetic defect, inherited genetic defects in RBC membrane or in enzyme or enzyme deficiencies, inherited genetic defects in RBC membrane, for example in hereditary spherocytosis and hereditary elliptocytosis, in enzyme deficiency, G6PD deficiency, pyruvate kinase deficiency. We will cover them. Hexokinase deficiency. The other category of increased RBC destruction is hemoglobin abnormalities or hemoglobinopathies. If defect in production of globin chain, as we know, hemoglobin is composed of heme plus globin. If the globin chain production is decreased or less, this condition is known as thalassemia. If is there any structural abnormality in globin, then this condition is known as sickle cell anemia. Sickle cell anemia. Another category of increased RBC destruction is acquired genetic defects. Acquired genetic defects. One of the example of acquired genetic defect is mutation of PIGA gene, phosphoinositol A gene, result in a condition known as PNH, paroxysmal nocturnal hemoglobinuria. Another condition of increased RBC destruction is antibody mediated RBC destruction. Antibody mediated RBC destruction. For example, hemolytic disease of newborn, transfusion reactions, drug associated destruction, and autoimmune disorders. For example, SLE. Increased RBC production can be seen in some infections of RBC by hemoparasites, namely malaria, babesiosis, toxic and chemical injury can also result into increased RBC destruction. In clostridial injury or clostridial sepsis, snake bite, lead poisoning, increased RBC destruction can be result due to the mechanical trauma. Microangiopathy, hemolytic anemia. In this category, we see hemolytic uremic syndrome, disseminated intravascular coagulation, and thrombotic thrombocytopenic purpura. Other causes of mechanical trauma to RBC are defective or prosthetic cardiac valves. Sequestration can also result in increased RBC destruction, which is seen in hypersplenism. Now we will discuss the last category of anemia, or which is known as impaired RBC production. We have discussed about the blood loss and increased RBC destruction. Now we'll discuss about the third category, impaired RBC production. Nutritional deficiencies result in decreased hemoglobin synthesis, iron deficiency. Deficiency leads to defected DNA synthesis. Vitamin B12 and folate deficiency, and vitamin C deficiency. Some inherited genetic defects also result in impaired RBC production, like defects affecting erythroblast maturation, which is seen in thalassemia. Genetic defects affecting stem cell or leads to stem cell depletion, which is seen in Fanconi anemia and telomerase defect. Erythropoietin deficiency can also result in impaired RBC production or decreased RBC production, which can be seen in renal failure and anemia of chronic disease. Immune mediated injury of progenitor of erythrocyte can also result in decreased RBC production, that is immune mediated injury to progenitors, which is seen in aplastic anemia or in pure red cell aplasia. Inflammation mediated iron sequestration seen in anemia of chronic disease. Anemia of chronic disease. Primary hematopoietic neoplasm. For example, acute leukemias, myelodysplastic syndrome, myeloproliferative disorders, etc. Infections of red cell progenitors. For example, parvovirus V19 infection, space occupying lesion, granulomatous condition, metastatic tumors, last condition is unknown. Mechanisms can also result in impaired RBC production, which can be related to endocrine disorders, liver diseases. Thank you.